Access to medications for a great amount of people within the country, but knowing and understanding that there are still far too many individuals that don't have access to health care. For the longest period of time, I've been fighting for early access to treatment for people with HIV before they progress to an AIDS diagnosis. Still in 2009, you have to have AIDS before you qualify for health care through Medicaid. Even more astonishing to me is that over 70% of the individuals that are acquiring HIV in the United States are gay and bisexual men. We don't even have a way to access or provide information to them. Our comprehensive sexuality education in our schools doesn't speak to them. It doesn't provide them with the information that they need to protect themselves, to protect their families and communities. How can we really get control of the epidemic if we're not speaking in a language to the people that we need to talk to the most? And then when we talk about access to resources, where can we find affordable clinics? Where can we find affordable health care? Where can we find quality food and nutrition in the areas that are most hardest hit by HIV, and that's in the poorest neighborhoods, in the Harlems, in the Detroits, in the areas of our country that are the most deracinated by poverty? How do we really speak to them and start to give them empowerment so that they can be able to control their own lives and control their susceptibility and vulnerability to HIV?
Thank you. You know, it occurs to me that we're beginning to respond to the issues of sexual minorities internationally, although very incrementally, and in some ways there are steps back when legislation is very punitive, particularly anti-gay legislation. But around women, we seem in many ways to be stalled. The disproportionate numbers of women, which is obviously a reality domestically as well as internationally, the world cannot adequately respond. Whatever it is that yields paralysis, the world around women, the gender inequality is so deeply entrenched, we're just not making the kind of progress we have to make. We're still at 61% of all of the population that's infected in Africa, 23 million people, 61% are women, and much higher percentages between the 15 and 24-year-old age groups. So where do we go around this particular issue, which is so vexing and so appalling?
I'd like to say that I think a couple of things we should certainly look to do. First, let's begin with the message. We need to have messages that relate to women across the board. I think there's still a lot of misperception that only a certain level of women are becoming infected. Low-income women, or women who are in the streets, or women who are engaged in drug use. We need a message that speaks to all women that this is a disease that potentially can affect all women. So that message must be directed to women of all ages, economic groups, geographical locations, and as I talk, for example, and my organization will recognize this, one of the women's organizations of which I'm a member of, the Links Service Organization, Phenomena, and they had a convention about last year, and for the first time they had a session on AIDS, and the title was, "What Does That, capital THT, have to do with me?" And once we began to talk about it, the transmission of this disease and how it affects all women, that turned around that conversation to encourage many of those same women to be active at the local level, making sure that they get tested, they become more educated, and to get involved. So I think the message is important. And the messenger is also is important. We need to make sure that we're involving women who are living with AIDS to be talking about these issues, to be at the tables making the decisions about budgets, about policies, about programs and services, and that they're not sitting on the sidelines when these kind of decisions are being made. And I think at least addressing the issues, some from that perspective, will lead us in a direction that I believe is certainly needed at this time.
Wafa.
I agree completely with my colleague. I think the issue is one needs to always reflect on what is the cause of that vulnerability of women in our midst in the U.S. and globally. And it's very complex. It has to do with vulnerability of women in general, not just to HIV. There are lots of structural issues about poverty, social issues, empowerment issues, control of the economy, education, access to a lot of opportunities within societies. And I think in a way one has to think of the vulnerability of women in the context of the societies in which they exist. And unfortunately, the societies often have not transformed themselves into equitable societies that really care about the women in a manner that can protect them. And in a way, our interventions have been maybe too narrowly focused. We've thought about the vulnerability in terms of sexual exposure and protection from a specific partner, rather than thinking of our interventions much more broadly based, of really broad interventions, more of structural interventions that are necessary. In this country, for example, issues about, in many rural areas in the South where many of the men are in prisons, the rates of imprisonments in our country is remarkable, especially amongst African American men. The issues about the educational system, disenfranchised education of teenagers in schools and the quality of school, all of these set vulnerabilities into motion, and I think we need to reflect and think much more broad-based in how to protect women. I also think we can't focus on women alone. We have to focus on the role of men. Men are very important, and when we're focusing on vulnerability of women, one also needs to bring the issues of boys and men and keep them front and central. I think I was just talking about a program that we're trying to envision that I'm calling Men Matter. Men do matter when you're trying to work with women in the field, when you're trying to protect women. It's very critical that boys are raised in a society that enables respect across between boys and girls, and therefore respect between men and women, and that there can be then the potential for generation of relationships of equity. And I think it's through these generations that hopefully we'll see a society where there's no violence, there's no sexual violence against women, there's no exploitation of women, there's protection of women, as well as also creating much more of a harmonious societies and harmonious communities around the world.
Wafa, those are generational things. They take a lot of time, and the women are being infected now and are in such a compromised position now. Well, what do you do about, internationally, what do you do about the significant transmission of the virus through sexual violence? Whether it's the politically orchestrated sexual violence of a Zimbabwe, or the post-election violence in a Kenya, or the terrifying violence of a Congo or a Darfur, or indeed the kinds of studies that have just been done in Swaziland, which show that young girls have been subject to an incredible degree of sexual violence within the home. They thought before they did the study, and it was a CDC study, that it would be in the schools. It turns out to be in the homes with intimate partners and relatives. How do you deal with those things, Wafa? How do we address them?
It's a very tough question. But we have to address them today. I think, again, we need to approach it at multi-levels. I think we have to have the laws that protect women, the laws that punish the perpetrators of violence, whatever that may be. That's very important. And then not only have the laws, but also respect those laws and take them to action so that people feel that they're going to be responsible for their actions. And then we need to work with the women themselves to empower them to speak up, that this is not the norm, this is not what should happen, that this is actually aberrant behavior that should be stopped, and to enable them through working. We do it through working of women's groups, for example. Women come together and one woman is able to speak up, and she creates that environment where other women can speak up, and lo and behold, you have a group of women who are speaking up and saying no. And I think it's an incremental process that will not happen overnight, but I think it has to be at multi-levels, at all levels of society, so that we can be working at all these levels so we can change and transform and protect these women from these very horrific events.
Mr. President, you've been so deeply involved in all of this as you've traveled. Did you make remarks on this?
Well, first, I think it's important to have individual role models who are respected and who speak out. And I agree with what Virginia said. In Lesotho and several other countries where we work, the most effective people are young people who are HIV positive, who talk about it and